Up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. So the question today, a common question, is what is a covered service under Medicare and what is not a covered service? And why is that important? The reason it's important is if it's a covered service, you have to bill Medicare if you're a physician. If it's a covered service and you want to charge the patient directly, you must opt out of Medicare in order to bill the patient for this covered service in cash. Otherwise, it's fraud. It's also not appropriate to see the Medicare patient and not charge them money, and we'll try to get into that a little bit. So maybe quickly, what are some things that are not covered? That's really what this video is about. What are some non-covered services? So a comprehensive wellness assessment is not covered. Why? Because Medicare says, look, you can do this annual wellness thing, but it's like limited to these kind of questions. A comprehensive, where you're talking about cancer prevention, longevity, optimal health, optimal sleep, and stress, that's not covered. So kind of like an executive physical is not covered. So you can charge a patient $10 million and tell them that it's not covered, but you must have them sign an ABN, which we'll get into. Longevity, anti-aging consultations, not covered, obviously. Medicare does not care about that. And who knows whether it's even effective or not, but obviously a lot of doctors believe it is. Functional medical evaluations are not covered, right? So looking way upstream at it for a medical condition, not covered. Mold and, all this like toxin and stool biome testing, not covered. So that means you can bill the patient directly and let them know, hey, Medicare doesn't cover this, so I'm allowed to charge you. What about nutritional counseling? Yes, if it's beyond diabetes education. So for example, if somebody is severely morbidly obese and you're giving them specific nutrition counseling just for morbid obesity or diabetic education, no, that's covered. So you can't do that. But if you do an overall nutritional counseling for like the whole human health, yes, that's not covered. So you can bill the patient directly. Supplement recommendations and monitoring, not covered by Medicare. That's an obvious one. Hormone optimization, absolutely not covered by Medicare. Menopause replacement stuff, you have to kind of check in. But of course, if you're doing something much more extensive like TSH and testosterone and estrogen and DHEA, no, that's not covered. IV vitamin and nutrient therapy is not covered, but be careful. Some state medical boards are very specific about that, so you do have to follow that. Aesthetic stuff is not covered, obviously. Now, going to kind of the realm of advanced testing, so comprehensive metabolic panels beyond standard labs. So this is like assessing somebody's HOMA-IR, fasting insulin. Those things are usually not covered. Micronutrient testing, I think it's like hemoglobin testing for whatever stuff. I don't know. Food sensitivity testing, usually not covered unless somebody has a very particular condition like anaphylaxis and you're an allergist. Genetic testing, kind of like overall genetic screening, is not covered. Advanced cardiac markers, so think like, what is that bio lab thing, that Boston lab thing that's like super extensive? That's not covered. Hormone panel for optimal health, if somebody's got chronic fatigue or whatever, not covered. Personal health coaching is not covered. Of course, why would we want people to be healthy? Personal health coaching, that's what I do, is not covered. So if I want to health coach somebody, even if I'm enrolled in Medicare, I can definitely do that because Medicare is like, oh, nope, we don't want you. We don't give a shit about that. We're not going to worry about you. Stress management programs. Now, of course, if somebody was recently hospitalized and they have acute psych conditions and you want to give them stress management just for that diagnosis, that's probably covered. But if it's stress management program in general, you have this entire wellness program thing that you're doing, go to town. Sleep optimization, usually not, unless somebody has a diagnosed insomnia and you're only specifically focusing on that. But if you have kind of like a larger sleep program, it's fine. We should talk about bundled stuff. You have to be careful. Though Medicare doesn't reimburse a lot of bundled services, for example, if you have like this wellness coaching and health coaching on top of managing somebody's UTI, this bundled service, yes, it will get denied by Medicare, but that UTI thing that you did in that bundled service, you have to unbundle that and bill Medicare separately. So no, you can't include that in there. So remember that. Just because you're like, oh, what I'll do is I'll talk about their, back hair. And while talking about their back hair, we're going to also address their back pain. Know what I'm saying? No, the back pain you're going to have to cover. You're going to have to bill. Fitness, exercise, of course not. Weight management programs. Beyond, so imagine somebody wants to optimize their weight and kind of like DEXA scan and body, what's that called? Body stuff. No, that you can totally bill the patient directly. That kind of weight management plan is not covered. But if somebody is like obese and that obesity has led to back pain or diabetes, and that's kind of like in the patient's overall Medicare chart. Remember, Medicare has a chart on everyone. You can't do that. So the concierge services are interesting. Again, go back to what I just said about bundling, but you can charge for extended consultation times. You can charge for same day appointments. You can charge for direct physician access, for personalized wellness plans, kind of like this concierge service. So you can charge a concierge fee of $1,000 a month and still bill Medicare. That's the beauty of it. Of course, yeah, I mean, well, we're not going to get into that, into the rest of it, but that's pretty powerful. The next thing I want to take you to is this article published by Wackler Blog. This is really just a good article about the ins and outs of opting out of Medicare. It's pretty simple. I'll see if I can leave this in the show descriptions. Honestly, I'm too lazy, so you just screenshot this. It's all coming from ChatGPT anyway, so it's pretty easy for you guys to do. And so this was a good article that I found. And I think it's worth reading just to understand what Medicare opting in and opting out works and looks like. The other one here is this was about understanding what is a covered and non-covered service. So, for example, we just talked about all the covered services and not covered services, but there is a process to doing this. So this article does a great job diving into it. So you need to have preemptive communication with the patient who voluntarily will sign the ABN, which is over here. So let's talk about the ABN real quick. The Advanced Beneficiary Notice of Non-Coverage, where I tell the patient that this D, I don't know why they put D, not A, I guess A is something else already, but D is this service that I'm going to offer the patient is not covered because Medicare has stated that it's not covered. And the estimated cost, and this has to be just an estimate within about $100. So if it's 1,000 and you put 500, that's not fair. You need to have the patient sign this, and you need to keep that in your documents because when you get audited by Medicare, they're going to want that. Read this notice. You can make informed decision about your care. Ask us any questions you may have after you finish reading. Choose an option below of whether you want to receive this service or not. So option 1 is yes, I want this service listed above. You may ask to be paid now, but I also want Medicare billed for an official decision on payment, which is then sent to me on the Medicare summary notice, MSN. Or I want the service above listed, but do not bill Medicare. You may ask to be paid now as I'm responsible for payment. I cannot appeal if Medicare is not billed. So this is you want somebody to choose option 2, or I don't want D at all. Look, thank you for telling me all this stuff. I don't even want it. Go fuck yourself. But you don't want option 1, and you obviously don't want option 3 because then you just wouldn't fill it out. And then the patient signs it and dates it. You have the right to get Medicare information in accessible format, like large print. Yeah, so there's a large print version of this you can download. They can contact Medicare for more information. And this refers to the rule and regulation of where this came from. So going back to this, you do need to sign this. I know it's a pain in the ass, but in general, if somebody's coming to your cash-based virtual medical practice or cash-based physical practice, and you're not doing stuff with Medicare patients, you just either refuse to see anybody who's Medicare age. You're allowed to do that. You say, no, I'm sorry, if you have Medicare, we just can't take you in this clinic. But you do need to double check that because there's all sorts of permutations of this. Your attorney has to be okay with it and they have to sign off on that. I've done other videos on it. I'm not going to get into the details of that. But when you do offer the services, just a simple signature that you can obtain from the client. And there are 2 main categories of services. So services that are not deemed medically reasonable, necessary, or just non-covered services. So a service that is deemed medically reasonable and necessary, not deemed medically reasonable is, for example, like, I don't know, coaching for diabetes is like not deemed medically reasonable. A non-covered service is like aesthetics. So there's just 2 different categories of things, but essentially fall under the same. I'm not going to go over the details of this. I kind of went over it. Workman's comp, obviously, it gets pulled out. Aesthetics gets pulled out. These are modifiers you can add. This is for billing services when you do send something to Medicare, especially for bundled stuff. And And the ABN must have the following stuff: a detailed description, estimated cost within 100, and the reason it is believed Medicare is not going to cover. That's your explanation. If you want more information, hey, reach out to these guys. They're called medical billers and coders. So we talked about this form. It's pretty straightforward. You can download it straight from Medicare. This is, I think, another article I found. Yeah, from AFP. So these are non-medical services. It's kind of like a regurgitation of the other stuff. There is a full list that Medicare keeps of all of the services that it normally covers. And if you look at the Medicare coverage database, then you can just kind of get an idea of what it is that they cover, what it is that they don't cover. There is a gosh, there was a you can actually click on it and find it. But anyway, it lists this whole huge thing um, that you can play around with. I didn't find it very useful. You can push it into a GPT and get some information from that. Um, Okay, if the policy is unclear, inform the patient that, hey, they might end up being, well, obviously, for those of you who are going to bill Medicare, you don't need to hear this from me. Just send it to your biller. So I'm not going to get into that. Um, and that is it. Non-covered. Certain services are never considered for payment by Medicare. These include preventative exams by CPT code this, certain immunizations. Medicare only covers influenza, hum, influenza, pneumonia, Hep B. I think they also now cover COVID. Prophylactic physician services that are like completely outside the realm. So yeah, this is kind of like a regurgitation. Yeah, I don't. This again, there was a better one. This is a good one. I think worth just look up MLN 906765. Um, Kind of goes over everything again, but in a lot more detail. So this is really talking about what is medically unreasonable and unnecessary service. And it starts on page 4. I've already gone through it. I'll give you an idea. So custodial services usually is not covered. Certain items that happen outside the US, except for emergencies, not covered. Personal comfort items that you purchase through Amazon is not covered. Routine services and supplies, we'll get into that. Cosmetic is not covered. Um, Things covered. Yeah. If your uncle gives you medical care, it's not covered. Dental services, certain things are covered, certain things are not. We're not going to go into inpatient care. Believe it or not, preventative foot care is not covered. Investigational devices are not covered. Services related to required to result of non-covered services. We'll get into that. Okay, so let's kind of dive into this. It's a little bit boring. Don't worry, you can review this later. You can have an LLM go through it and give you a good summary. Now, remember, we're not talking about Part D here, right? So Part A, Part B, um, Part C, which is right? That's the Medicare Advantage, I think. Whatever. Am I confusing them? So if a commercial plan is servicing the Medicare, they might have their own complete coverage stuff. But remember, just because their Aetna is servicing their Medicare, it's still a Medicare patient, so you still have to treat it the same. So let's see. Evaluation and management of exceeding those considered medically reasonable and necessary. So if you explain it to the patient properly, like, look, hey, this thing that we're doing is really, really Medicare doesn't really consider it necessary or reasonable. And so for those reasons, I'm going to go ahead and bill you separately for this. Um, and then, and that's again, remember, you're not trying to opt out of Medicare. Excessive therapy or diagnostic procedures. So maybe having them come in every single day for A1C checks or weight checks or VO2 max. None of that stuff is covered, right? Unrelated screening tests, exam, therapies where the patient has no symptoms or diagnosis. So think of like Pernuvo, and MRIs and all these other screening tests that people are doing. Um, and unnecessary services, transcendental meditation based on patient's diagnosis. Holy shit. Yeah. Um, Items and services administered to the patient to cause or assist in death. So assisted suicide is apparently not covered. If you didn't know that, now you do because of the Digital Nomad Physician website. I mean, if I wasn't here, the fuck would you all do? Custodial care, we're not going to get into that. Exceptions, we're not going to get into that. There was some things that I thought was interesting. War, phones. All right, I'll leave it alone. It's essentially what I've covered so far. Um, yeah, I'll leave this alone. You guys can review this in more detail. There's like a ton of pages on this, so it is worth reviewing. We've already went over this. Oh, but I thought, yeah, this was kind of a good one. Some of the items and services Medicare doesn't cover is things like eye exams for prescription glasses, long-term care, which is something totally different, cosmetics, yeah, massage therapy. So if you're doing any kind of massage therapy while you're doing some other kind of coaching and behavioral or feedback or um, other type of stuff, this is great. You can offer that if you're doing it in person. Routine physical exams. So again, this is kind of like you're recommending a Q3 month exam, even though it's not part of their annual exam. Um, we talked about concierge care, but remember you can bundle it. This is direct care services, platinum practice, boutique medicine, retainer based medicine, and concierge. These are all the different services. If you don't know the difference, go look at it. I've talked about it in other videos. Covered items and services you get from a doctor or other provider that has opted out of participating in Medicare, obviously. Um, yeah, that's it. So I hope this is of value. I hope you guys got a sense of the things that are covered, not covered, and how you can kind of structure your services in a way that makes sense. Take care.